point is treatable for the abduction of the shoulder is not possible. That time adhesive capsulitis or the frozen shoulder you can use it. At the same time, when the patient cannot take the hand on the backward direction, so this particular situation you just use it the point. But this is really important point where exactly the teres minor muscles or the posterior deltoid muscles you can find this particular point. At the same time, there is a spleen, that is SI10 point is the now show. This point is located vertically above this SI9 and then inferior border of the spine of the scapula. You find out from here, you can go, you can touch, you can find the spine of the scapula, but the inferior border of the spine of the scapula bone in the depression, this point is located, that point is SI10. So SI10 point is just apply. SI10 point is also useful to treat for the especially for the shoulder where the posterior shoulder pain is there. That time we just insert the needle on the SI10. So 1 to 1.5 tune you can insert the needle, but not more than that. That causes again related to the pneumothorax or the lungs will get damaged. But now you just come down at the center of the now you can find out this is the scapular region, this is the pit of the scapula. Pit means is the lower portion of the scapula, and then from here this is the superior border of the spine of the scapula. Make it as a 3 segments. This 1 segment, this is the 2 segment, and this is the 3 segment. On the upper 1/3, exactly related to the 4th thoracic vertebra. This is the 1st thoracic, 2nd thoracic, 3rd thoracic, 4th thoracic. 4th thoracic vertebra, you just come straight line. This point is on SI, that is small intestine 11 point. So this point is especially useful to treat for the all the breast related disorders, especially for the milk secretion is not taking place, or the hypogalacturia or the hypogalactia. Galacturia is the excessive secretion of the milk. Hypogalacturia where the less lactation is there, milk secretion is not taking place. That particular time, this is the parallel point of the nipple region. This point is really good point to treat for all the chest related disorder. The patient is complaining, I do have the pain on my pectoralis major muscles or the minor muscles, and also on the sternum related places, and also there is the ribs pain also they do have. That condition you wanted to use activate this on the back points, because according to the traditional Chinese medicine it says the front side problem treatable on the back and then vice versa, top diseases treatable down and then vice versa. In this way the pain is problem is on this region, then we can treat for the on the back region of the scapular region. By the way, there are the 2 advantages by using this point. If the patient is complaining, I do have the pain on this region, especially when the shoulder pain is there, that time this scapularis muscle, that is the infraspinatus muscles, this the supraspinatus muscles, trapezius muscles, this all will be affected. That time we wanted to use this point to treat and release the fascia, and then we just apply to the deeper level. That would be better. Once we apply the needle on the 1 tune, maximum you can use it, but better don't use the 1.5 tune needle, is not much advisable. Now you can use this point for the nipple related disorders. Now the Ping Feng, so this specific point is treatable for the many indications, is for the pain related condition, especially the Bing Feng, that means is the wind related disorders, or the arthralgia, arthritis related disorders, or the hormonal related conditions. We can use this point, that is the Bing Feng, that is the SI12 point. You can use any one. Apply this point on the superior border of the spine of the scapula. This is SI12 point. Right, now we are talking about the SI13 point, where exactly is located exactly on the medial end of the spine of the scapula. This is the center of the spine of the scapula in the fossa. From here you press the bone and then come to the lateral side. This is the medial side and this is the lateral side. But however you come to the medial side, then you can find the depression. In this depression, this point is Chuyuan. Chuyuan is the Quyuan. Chuyuan point is located. You apply the needle on this region. This will be helpful to treat for the scapula related pain. But especially on the superior border of the scapula, this point is really good point enough. Now these are the points where exactly is located Qianqing. Qianqing means is the GB21. GB21, these points are located, and then Sanjo 15, these points are located here. But these points are one or other way will be useful to treat for the hormone related disorders. This is called as the posterior pituitary point. Pituitary, anterior pituitary. Anterior pituitary is the GB20 region. That is the gallbladder 12 is the anterior pituitary, but this is related to the posterior pituitary point. Certainly we can use this point is the SI13 as well. Then the SI14 point. SI14 point, as I told you, these muscles are coming from the neck region to here. So this is the entire region to be known as a levator scapularis muscles. This muscles called as a levator scapularis muscles. If this pain is there on the, so this is connecting to the superior border of the spine. So now this anything, this is the neck and then scapula related problem. Patient is complaining, I have the neck pain and also my scapular pain, and that time certainly we select is the one specific point, that is SI14 Qian Y Shu is advisable. You just apply the needle again. SI14. Right. Then this is, if wanted to apply the levator scapula, you just give the pressure. When the patient is complaining on this specific region, there you just insert the needle if the tenderness is there. But no acupuncture point, you need not to worry. If the tenderness is there, that particular muscles you wanted to treat, you can treat. By the way, this point to be known as a rhomboid major muscles motor point as well. 3 Chun lateral to this region is the rhomboid muscles, but motor point here, no doubt this is the lateral side of the vesical meridian pathway, but this is, you come here on the 2 Chun lateral, this also motor point of the erector spinae muscles. So all the spinalis muscles motor points are existing here. So SI15 is the great point to treat for the, especially for the neck related problem, neck pain, and then the pain is on the rhomboid muscles pain. So that time we insert the needle to the deeper level. So we can use it at least is a 1 to 1.5 Chun maximum needle can be inserted on the SI15 region. Hopefully on the cervical pain and then shoulder related problem certainly can be treatable by activating this point. Once we do the strong stimulation is advisable. We wanted to use as a wire stimulation, that would be better, or we wanted to use hold the needle, mild vibration to be taken place on the muscle system. Now I have kept the muscle on the 4th frequency of the pen. So once we touch to the one needle and then place it on the other hand fingers on the other needle. So once keep on to doing the same, the patient feel lot of vibration internally. Are you feeling done? What are you feeling? Twitching sensation and then pain inside the patient is feeling, indicating that some kind of the muscles internally, the muscles are getting changes or the fascia is getting releases internally. But this one or other way can be useful to treat for the shoulder and then neck related disorders. If the small intestine having the deficiency, along with that you wanted to use the SI3. SI3 is the point exactly where the head and neck related disorders, you just apply the needle SI3 and then you just activate this also as a stimulation, and the patient feels some kind of the vibration over this region, and this will regulate to the shoulder brachial syndrome as well.